You know, our bodies have this incredible autopilot system that's running 24/7, right? It's managing everything from our heart rate to our breathing, and we never even have to think about it. But what happens when we need to step in and adjust those controls for medical reasons? Well, today we're going to explore the powerful drugs that do exactly that. Welcome to LEMP Pharmacy Tutorial. Today we're diving deep into the pharmacology of the autonomic nervous system. Understanding how all this works isn't just theory, it is absolutely essential for any healthcare professional out there. It's the foundation for so much of what we do. So, here's what we've got on the docket. We'll start with the basics of the autonomic nervous system. Then, we'll get into its two famous opposing sides, fight or flight, and rest and digest. And for each one, we'll unpack the drugs that target them. That's the adrenergic and cholinergic drugs. Then, of course, we'll wrap it all up with a solid recap. Let's get right to it. Right, first up, the autonomic nervous system. I really like thinking of it as the body's automatic control panel. It's this incredibly complex software that's just running in the background, making sure the entire machine, that's you, is humming along perfectly without you lifting a finger. To really get a sense of where the autonomic nervous system, or ANS for short, fits in, this chart is super helpful. You see, our whole nervous system splits into the central and the peripheral, and it's tucked away in that peripheral system where we find our two key players, the somatic system and our main event for today, the autonomic system. So what's the big difference between them? Honestly, it all just boils down to control. The somatic system is all voluntary. You choose to walk across the room, and your skeletal muscles make it happen. But the autonomic system, that's involuntary. You don't consciously tell your heart to beat or your glands to sweat. It just happens, automatically. And here it is, the core definition. The ANS is the master regulator of all those things we don't think about. Now, the most crucial part to grasp is that it does this through a beautiful balancing act between its two divisions, the sympathetic and the parasympathetic. Just picture them on a seesaw, constantly adjusting to keep our bodies in a stable state of balance, or what we call homeostasis. Okay, let's kick things off with the more famous of the two, the fight or flight system. That's the catchy nickname for the sympathetic nervous system. This is your body's emergency response system. Just imagine you're walking home late at night and hear a sudden noise behind you. Instantly, your sympathetic system goes into overdrive. Your heart starts pounding, your pupils get huge to let in more light, and blood gets rerouted to your muscles. You're primed and ready to either fight whatever is there or run for it. Let's break that down a bit more. In the heart, it ramps up the speed and the force of each beat. In your eyes, it widens the pupils. We call that mydriasis. It shunts blood towards your big skeletal muscles for action. And, quite logically, it hits the pause button on things like digestion. I mean, who has time to digest a sandwich when you might be in danger? So how does this system send out all these urgent commands? It uses chemical messengers called neurotransmitters. For the sympathetic system, the big ones are norepinephrine and epinephrine. You might know them better as noradrenaline and adrenaline. These chemicals latch onto specific docking stations on our cells called adrenoreceptors. Now burn that name into your memory. It's the key to all the pharmacology that follows. And that brings us perfectly to adrenergic drugs. Think of the sympathetic system as a powerful engine. Well, these drugs are the tools in our kit that let us either rev that engine up or dial it back down, giving us precise control over that fight or flight response. Adrenergic drugs really fall into two main camps. First, we have the agonists, which basically mimic or boost the effects of norepinephrine and epinephrine. And then we have the antagonists, which do the opposite. They block those effects. And within each of those camps, we can get even more specific, as the drugs target different types of receptors, mainly alpha or beta. Let's start with the agonists, and specifically the ones that target alpha-1 receptors. You've definitely seen these before. Pseudoephedrine and phenylephrine are in tons of over-the-counter cold medicines. What they do is cause vasoconstriction, which just means they narrow the blood vessels. So when you have a cold and the vessels in your nose are all swollen, these drugs shrink them down and voila, you can breathe again. That's why they're such great nasal decongestants. But here's a really important clinical pearl you need to know. As great as they are, if you overuse these decongestants, you can get something called rebound congestion. Basically, your body gets so used to the drug constricting those vessels that when you stop taking it, they can swell up even more than before. It's a classic case of too much of a good thing. Now let's talk about another type of agonist, beta-2 agonists. These are, quite literally, lifesavers. Drugs like salbutamol, which you might know as albuterol, target beta-2 receptors that are mostly found in the lungs. When you activate them, the smooth muscle in the airways relaxes and the airways open up. That effect, bronchodilation, is exactly what someone having an asthma attack needs to be able to breathe again. Okay, let's switch gears from agonists to antagonists, the blockers. Alpha-1 blockers, like prazosin, do the complete opposite of what we just talked about. By blocking alpha-1 receptors on blood vessels, they cause vasodilation. The vessels widen. This helps lower blood pressure, making them really useful for hypertension. They also relax the muscle around the bladder, which helps patients with an enlarged prostate, or BPH. And this is another one of those absolutely critical warnings, because these drugs can drop blood pressure so well, the very first dose can sometimes cause it to drop too much too fast, leading to dizziness or even fainting. We call this first dose orthostatic hypotension. It's exactly why patients are usually told to take that first pill right at bedtime just to be safe. And finally, for this section, we have one of the most common drug classes on the planet, beta blockers. They block beta receptors, mainly in the heart, to slow the heart rate and reduce how forcefully it pumps. Now, some like propranolol are non-selective. They block a few types of beta receptors, while others, like atenolol, are cardioselective, meaning they focus mainly on the heart. Their uses are massive, from hypertension to angina, and even irregular heartbeats. All right, we've had a really good look at the body's accelerator pedal. Now it's time to check out the brakes. Let's move on to the rest and digest system, better known as the parasympathetic nervous system. This system is the complete opposite of the sympathetic system. It's the one that's in charge during all those quiet, calm moments. Its main job is to conserve energy and take care of all the body's routine housekeeping. And as you can see, its effects are the mirror image of what we saw before. The heart slows down, pupils get smaller, and the digestive system kicks back into gear. So if we look at its main jobs, you see this clear pattern of maintenance and calm. It slows the heart rate, it constricts the pupils, a state we call meiosis. It gets the salivary glands going and stimulates the whole GI tract for digestion, and it helps contract the bladder for urination. It's basically running all the essential background operations that keep you ticking over nicely. So, what's the chemical messenger for this side of things? Well, it's a neurotransmitter called acetylcholine, or ACH for short. And just like the other system had adrenergic receptors, this one has its own docking stations called cholinergic receptors. And these mainly come in two flavors, muscarinic and nicotinic. And that naturally leads us straight into the drugs. Let's talk about cholinergic drugs. These are the tools we use to either ramp up or tamp down the body's rest and digest functions. Just like their adrenergic cousins, the cholinergic family has agonists that stimulate the system and antagonists that block it. Now, the agonists are a little more interesting here because they can work in two ways. Direct agonists bind right to the receptors themselves, while indirect agonists work by stopping acetylcholine from being broken down. The antagonists are a bit more straightforward. We usually just call them anticholinergic. Let's start with those direct-acting agonists. Bethanechol, for instance, is brilliant at stimulating the receptors on the bladder, helping it to contract. So we use it to treat urinary retention. Pilocarpine, on the other hand, is often used as an eye drop. It acts on receptors in the eye to shrink the pupil, which helps drain fluid and lower the pressure in conditions like glaucoma. Now, for the indirect agonists, these are pretty clever. They work by blocking an enzyme called acetylcholinesterase. That's the enzyme that normally cleans up and breaks down acetylcholine. So by blocking the cleanup crew, they increase the amount of acetylcholine that's hanging around to do its job. Neostigmine uses this trick to help improve muscle strength in myasthenia gravis, while donepezil does it to boost cognitive function in Alzheimer's. Okay, so what happens if you get too much cholinergic stimulation? Well, you get a massive exaggeration of all those rest and digest functions. And there's a fantastic mnemonic to remember the side effects: dumbbells. It stands for diarrhea, urination, meiosis, bradycardia, bronchoconstriction, emesis, lacrimation, and salivation. It paints a very wet picture of what happens. So, what if we want to block all those effects? That's where anticholinergics come into play. These drugs sit on the muscarinic receptors and block acetylcholine from binding. Atropine is a powerful antidote for things like nerve gas poisoning. Ipratropium is inhaled to open the airways in COPD, and scopolamine is famously used in patches to stop motion sickness. And this slide just perfectly sums up the push and pull of these two systems. Their side effect profiles are polar opposites. Cholinergic effects are wet. Think salivation, tears, diarrhea.
Anticholinergic side effects are dry. We're talking dry mouth, blurred vision, urinary retention, and constipation. There's a classic little rhyme for it. Can't see, can't pee, can't spit, well, you can figure out the last one.
Pooh, okay. We have covered a massive amount of ground, from the basic layout of the nervous system all the way to 4 major classes of drugs. Let's just take a quick moment to tie it all together with a recap. So if you remember nothing else, remember these 5 things. 1. The ANS is a balancing act between sympathetic and parasympathetic. 2. Adrenergic drugs tune the fight or flight system. 3. Cholinergic drugs tune the rest and digest system. 4, and this is simple but crucial, agonists activate, antagonists lock. And 5, our whole goal in using these drugs is to restore a healthy balance in the body. This final chart is a fantastic study tool, really. It lays out all 4 major drug classes side by side. You can clearly see how an adrenergic agonist revs up the sympathetic system for something like asthma, while an adrenergic antagonist slows it down for hypertension. And that same push-pull relationship holds true for the cholinergic and anticholinergic drugs. It's all about pushing and pulling the 2 main levers of the body's control panel. So I'll leave you with this question to mull over. How can really understanding this fundamental dance between fight or flight and rest and digest change the way you approach pharmacology? It's so much more than just memorizing drug names. It's about seeing this elegant, predictable, and incredibly powerful system at work.
Next episode, we will be talking about pharmacology of histamines and serotonin. Be sure to join in.